In the last chapter, chapter 14, we introduced the concept of preventive medicine, which, if you remember, kind of focuses on the levels of prevention, primary, secondary, and tertiary. So in this chapter, the focus will be on primary, where kind of one key activity is in promoting health or health promotion. Whenever we study a disease, we study a health problem, a health issue, sometimes it's useful to use a model. In this case, what we see here is the socio-ecological model. And models give us a perspective, and it helps us to frame an issue and or problem in health, for example. So whenever we talk about a specific disease, disorder, or health problem or issue, we can utilize the socioeconomic model to look at specific variables, factors, such as you can see here, starting from kind of the most outside part of the concentric circles, structures, policies, the system, the institutions, community, interpersonal, and then finally to the level of the individual. When we talk about what impacts health, for example, and thinking about that, the socioecological model, we think about broad societal influences. So for example, when we talk about demographics, you've heard the term socioeconomics. So socioeconomics is a form of demographics that is important to look at as a variable in terms of health. Everything from your income, education, status can play a role in health. Others include opportunities for safe employment. So with respect to your occupation, some occupations are more hazardous than others. If you are a working professional, as the saying goes, if you have a white collar position versus a blue collar position, white collar positions tend to have the perception of it being more safe, that there's not a lot of hazards to white collar positions where you primarily might be in a very safe office as opposed to being outside in the environment, for example. At the societal level, there are various environmental systems that can profoundly impact our health. So think about smoking and how smoking as a social norm has changed over time, how smoking rules and regulations have increased over time. Another example is garbage or trash and sanitation and how that has improved over time as well. And of course, to counteract and combat these issues would be rules and laws, so regulation of the environment, commerce, and public safety. So the specific definition of health promotion that has been defined by the World Health Organization, the process of enabling people to increase control over their health and its determinants and thereby to improve their health. And there are two types we see. There is a general health promotion as well as specific protection activities. So you can understand that some of the examples with respect to dietary intake, physical activity, abstaining from tobacco, medication adherence, and weight loss. These are very general health promoting activities that kind of addresses general health. whereas specific protection activities, for example, combating viruses, bacteria, they're going to require specific vaccines and specific antimicrobial drugs, for example. And then even certain diseases might need very specific nutritional interventions, and we'll leave it at that. So whenever we think about behavior as a potential variable or factor in our health, and we ascertain that behavior is a factor. So for example, tobacco use, physical activity, as well as nutrition. These are all behaviors that human beings undertake for positive as well as negative reasons. So again, when we talked about the socioecological model for change, it is important to talk about ways or models, frameworks, and theories that can help guide a practitioner and a scientist to determine what theory to utilize as a framework, such as the health belief model, the stages of change model. The stages of change model is also known as the trans-theoretical model and is very much utilized in the area of tobacco cessation. You can also see the main focus of these theories, and I mentioned health belief model and stages of change model because these are the two that are used quite regularly in health promotion. And the key concepts to underscore with health belief model and stages of change, you can see that in health belief model, we're really trying to understand what the individual perceives are the susceptibilities, what the individual perceives as the severities, as well as the benefits and barriers. And then from here, once you can ascertain these perceptions, you can focus on, well, what are some of the cues to a particular action of doing a negative or a positive behavior, for example. And then self-efficacy is the idea of empowerment and self-control to move forward, especially with respect to positive changes. I just want to mention briefly in the stages of change, or the trans-theoretical, that these are the stages that someone would undergo in terms of trying to quit tobacco. Pre-contemplation, contemplation, decision, action, and maintenance. And the book does a great job of kind of outlining where a tobacco user would be with respect to the stages of change model. Speaking of tobacco cessation, and in general, trying to motivate people to change behavior if behavior is a key area in terms of promoting health, is utilizing motivational interviewing to influence a individual's behavioral change for the positive, obviously. And here in this slide, we'll talk about the three main concepts in getting a patient to understand their problem. So meaning patients are ambivalent. They have mixed feelings about their particular behavior, such as smoking. On one hand, they want to quit. On the other hand, they're so physically and sometimes psychologically dependent on cigarettes or tobacco. The second part of the three main concepts include in motivational interviewing, it's important for the patient to talk out loud. So the second bullet here is, I learn what I believe as I hear myself talk. You as a pharmacist, as a clinician, as a nurse, as a physician, whatever it may be, in motivational interviewing, it's good practice for letting the patient basically talk out their problem. And the more that they can articulate what their problem is, they kind of have that aha moment. So that aha moment in motivational interviewing is important for getting the patient to make the right decisions and make that change. And then kind of thirdly in this main concept include changes motivated by the perceived dissonance between current behavior and current goals. So as they talk about it, dissonance, you can think of dissonance as a lack of harmony or tension. So the more that they talk about it and the more they see that there's this difference between what their current behavior is and what their goals are, they're going to be more they'll be more readily be available to make changes in their behavior. And so what are other strategies? You can see here it's expressing empathy. As healthcare providers, this is one key characteristics of us who are in healthcare field, right? We're very empathetic. We want to understand people's feelings. Again, developing this cognitive dissonance for the patient to understand that they have this ambivalent issue and that there is this tension between their current behavior and goals. It's good for them to know that tension is preventing them from moving along to their health goals, for example. So the third strategy is rolling with resistance. Okay, so sometimes that as a patient goes through this dissonance, they might have varying degrees of feelings and attitudes and emotion. They can range from anger to just being emotional as well as being resistant. So you want to, as a health counselor and as their provider, you want to make sure you kind of roll with it, meaning you don't want to resist it, but at the same time you want to make sure that they're talking through their key triggers. You're talking them through how you can help them and make them understand where they can help themselves. And then lastly is supporting self-efficacy. So the idea of empowering the patient, and that's what motivational interviewing is trying to empower the patients for them to become self-aware and self-motivated towards their goals. And then finally, this aspects of coming to a decision is generally shared. Sometimes patients don't want to do it by themselves and they feel better when they are being guided, but at the same time, when they have complete self-efficacy, they become more empowered and understand that they are the ones who have made the change, and so they become more confident and their self-esteem is much better. So here, stepping back a bit, here are some goals that we can discuss with respect to some specific protections in primary prevention. So if your goal is in prevention of specific diseases, use of vaccines and antimicrobials, is a good idea. Prophylaxis, meaning to take medication to prevent a disease. Prevention of specific deficiency states. So in nutrition, we think about the condition of goiter, and so iodized salt helps to prevent that, as well as in the area of teeth decay, obviously regular brushing, as well as the use of fluoride helps to prevent cavities and decay. More other areas of prevention, and specifically preventing specific injuries and avoiding toxic exposures, so the use of helmets in construction workers, goggles to prevent eye injuries, or even the use of ear protection or sound protection mechanisms to prevent ear loss for those who might be working in loud areas, whether it's in construction or even in the music industry, if you work and consistently are exposed to loud music, for example. Now, getting back to specifically related to infectious disease and the idea of vaccines. So when we talk about protecting individuals from specifically viruses and antimicrobials that can impact our immune system, we think about these three definitions that are important when it comes to immunity and vaccination. So intact immunity, passive immunity, and then active immunity. Now, active immunity just implies that the immune system is healthy at birth and that there's no damage from things like a disease like HIV or side effects from medications, anti-cancer drugs, that it did not damage your immunity, so you have intact immunity. Passive immunity, if you had this in anatomy and physiology at one point, remember that it's protection against an infectious disease provided by circulating antibodies made in another organism. So this, unfortunately, this sometimes provides an incomplete protection, and it's usually a short duration. You can see some examples in the next sub-bullet. Whereas active immunity, this usually is conferred by, again, vaccines, much superior to passive immunity. It lasts longer and is rapidly stimulated when you're re-exposed to that same or closely related antigen. And again, sub-bullet shows the other aspects of active immunity. When we talk about vaccines, there are these three vaccine types that you see. There's inactivated, live attenuated, or toxoid. Its description and the examples of bacterial or viral that is utilized to create a vaccine. So those are just, you might have heard of pertussis and typhoid, as well as influenza. And in live attenuated, you see a bacteria called the Bacilli calmette guerin, or otherwise known as BCG. Measles and oral polio are examples of viral vaccines. And then diphtheria and tetanus vaccines are examples of toxoid. The book spends some more on immunity and preventing infectious disease through vaccination. because this is one of the primary activities in primary prevention is vaccination. What this slide shows is that, well, how do we test the efficacy of vaccines? We can test them in a number of ways, and this table shows 4 different study types. And you may have heard of randomized controlled trial. So here just titled randomized field trial. And you can see that there's a randomization versus the other 3. Retrospective, case control, and incident density. They lack randomization. So from a purely research design standpoint, when there is randomization, it does improve the statistical analysis and the design of the study so that you can be more confident in assessing the vaccine's effectiveness, for example. So you can see how in a randomized field trial, the benefit is that we can determine attack rate as well as vaccine effectiveness more concretely versus the other 3 study types. And you can see some of the risk. It oftentimes is very costly, requires a large sample, and sometimes it's impossible to perform for uncommon diseases. However, there are some benefits to the other 3, retrospective, case control, and incident. You can see that some of the benefits include requiring less time and smaller sample sizes. However, their risk are there could be selection bias in a retrospective cohort because you're picking subjects who have been exposed and there's no randomization. So that's the problem with these types of studies. Once there is no randomization, you run into a problem with selection bias. And we could see other examples that you can read through yourself, please. And in epidemiology, when you want to know and understand the disease, so in the use of and determining vaccines and the attack rate of a pathogen and the effectiveness of a therapeutic like a vaccine, when you undergo a randomized field trial, you can see the steps here where we look at the susceptible persons at the beginning of a high-risk season, for example. And here is where the randomization takes place. And so here you avoid selection bias because the randomization takes place, and they either go into the vaccine, or sometimes called the treatment group, and then the placebo group, sometimes call this the control group in a randomized controlled trial. And what we should be able to ascertain and determine will be the attack rate as well as the vaccine effectiveness. So the attack rate is equal to the number of persons ill divided by the number of persons exposed to the disease. And then the vaccine effectiveness is you take the attack rate of the unvaccinated subjects versus the attack rate of the vaccinated subjects, times that by 100 and divided that by the attack rate of the unvaccinated, and you get the effectiveness of the vaccine. And here we talk about, well, what are the goals of immunization? What are the contraindications to vaccines? What would prevent you from, what should prevent us from vaccinating people? And the last uh, box is what are not contraindicated to vaccines. So things that might show up as signs and symptoms, but they're not contraindicated to the use of vaccine. So let's start with immunization goals. So it's obviously to eradicate disease. When it comes to very highly virulent and highly lethal diseases like the smallpox, and even more current times with Ebola, it's important to completely get rid of a disease that is very highly infectious, contagious, dangerous, and causes a lot of morbidity and mortality. So that eradication kind of goes along the lines with regional elimination as well as controlling a disease such as chickenpox. Well, sometimes vaccines, they do have side effects. So if there are side effects such as encephalitis, especially if it is not explainable, then that the vaccine could be dangerous and it warrants a red flag. Apnea, anaphylaxis, and then pregnancy or immunocompromised with live virus vaccine. So those are obviously contraindicated, the use of vaccines. Not contraindications, so if there's just a mild reaction to previous DTaP exposure, then not to be too concerned. Presence of nonspecific allergies, mild illness or diarrhea with a low-grade fever in otherwise healthy people, not contraindicated. Current therapy with antimicrobial drugs in a patient who is convalescing, breastfeeding an infant, pregnancy of someone else in the household, not contraindicated. This table just shows a list of diseases to prevent, the causative organism, as well as examples of drug prophylaxis. So diseases that include malaria, tuberculosis, endocarditis, meningitis, syphilis, gonorrhea, HIV infection. And associated with that are, again, its causative agent. And since this is not an infectious disease class, don't expect you to know every disease and its causative agent, but we'll let you know which ones to focus on for testing purposes. In stepping back again and let's look at another aspect of health promotion is, and we mentioned this already in earlier slides, but preventing deficiencies, prevention of a deficiency. And more often, there are diseases that you have been familiar with over time, and these are also might be familiar to you. So goiter, rickets, again, dental caries, as well as neural tube defects. And you can see what the disease and its associated interventions are. So for goiter, it's iodine and salt. Rickets, it's vitamin D in milk. So vitamin D fortification is important in milk. We also understand the importance of drinking tap water, because in tap water you have fluoride. And interestingly, bottled water for many years didn't contain fluoride, but in more current times, I've noticed the use of supplementing bottled water with fluoride. And folic acid enrichment of cereal grains to properly develop, especially with respect to genetics and DNA and associated neural tube defects. Also, kind of broadly speaking, when we talk about health promotion, it seems like a way back ago when we first had the slide on the socio-ecological model, but when we talk about healthcare disparities, this is an area of another societal level that could impact health. So there are some reasons for healthcare disparities, as mentioned here. It could be as a result of just a different disposition to genetics. You might be more prone to this or that cardiovascular condition, environment, poor lifestyle choices, difference in care-seeking behaviors. Some cultures seek out help. Some cultures don't seek out help. There's also the language barrier, so another cultural related barrier. And also similarly, a lack of trust in healthcare is another type of cultural barrier. So strategies to reduce select reasons for healthcare disparities. These strategies are becoming more prevalent especially in our healthcare professionals training. So training and our systems to have the resources to deal with culturally and linguistic services. These are things that healthcare systems are very keen on to help alleviate any barriers that are related to culture and linguistics, for example. And I guess related to that would be improving health literacy as well as improving cultural competence training. So those two kind of go hand in hand as well. So what are some of the interventions to address a problem like health literacy? Well, here are just three areas and skills and techniques that can be very helpful when it comes to dealing with a health literacy issue. So you can redesign something. You can make sure that the functioning of the patient-provider communication is optimal. So for example, making sure that the reading level is at an appropriate stage or level, which is usually grade 6. And simplifying content and design is another kind of a redesigning technique. Another area of importance, and this kind of falls onto communication, effective communication, is teaching back. So asking the patient to teach the provider to confirm the understanding. I know some of you are getting these kind of training when you're in your classes or courses in applied patient care, for example. And then related to communication is ask me 3. So you're asking, what is my main problem? What do I need to do? And why is it important for me to do this? So the patient is asking those to their provider. So in summary, there There's a lot of aspects of primary prevention, but it does begin with promoting health, and that in and of itself is a whole science, is a whole art. There's a lot of skill, there's a lot of innovation that can be incorporated in promoting health. It's important to look at the models like health behavior theories, other tools like motivational interviewing. These can all be important in promoting healthy behavior. And then primary prevention strategies, they focus on the use of very specific interventions to protect the individuals against a disease, as we've talked about, especially with respect to infectious disease, deficiency states, like nutritional states, injuries, occupational injuries, environmental injuries, which we didn't get to talk a whole lot about, but that is, again, a whole science of itself, is in occupational health. And then toxic exposures, again, another area of environmental health that has many opportunities and many problems and many opportunities to study if you have an interest in that area. And then lastly, in terms of health promotion, thinking about healthcare disparities in the context of that socio-ecological model, that it's important to be culturally and linguistically appropriate and providing services that won't let these cultural things be of a barrier. Thank you very much.